amendment.
Mr. Chairman, when Mr. Walden was here, he was indicating an appreciation of the urgency of attempting to address the cost of health care, something that he said we would do down the line. And there's a number of colleagues on your side who are working hard on that. Mr. Griffin is working with me. Dr. Bouchon, I think, has been a leader on this, and there's an immense amount of interest on our side. But here's the deal. We do nothing in this bill to address cost. And, in fact, that's where the money is. If we start bringing down the cost, it's going to make things much more possible for us to get health care delivered to the people who need it. One of the areas where cost is totally exploding is pharmaceutical drugs. Just think about it. Sovaldi, a drug to treat hepatitis C, $84,000 for a 12-week treatment course. Turing Pharmaceuticals, because they bought a company that had a drug that was selling for $15, it ended up being sold right after the company bought it for $1,500. Where parents in Vermont contacted me. This is about providing what a child needs when they go into shock. That is sold for $600, 400% more than it was just a few years ago. And by the way, that company that is headquartered in the Netherlands, U.S. company Mylan, sells that same item in the Netherlands for $100. We are getting ripped off. Now, the cost that what we're spending on pharmaceutical drugs, a total of almost 3/4 of the average social. Mr. Chairman, the committee's not in order. Committee's not in order. Mr. Chairman.
Gentleman is correct. Committee's not in order.
What was that?
Gentleman will proceed.
All right, Mr. President, or Mr. Chairman, according to the AARP report, the average annual retail price of drugs was over $11,000 in 2013 for a patient who had prescriptions for a chronic illness. That's almost 3/4 of the average Social Security retirement benefit of $15,526 and nearly half the median income of somebody on $23,500. This amendment is about making certain that nothing in this legislation is going to aggravate the already excessive burden with the cost of prescription medication. I'd like to remind the committee that Mr. President Trump spoke about prescription drugs and what a bad deal the American consumer was getting with the high cost of prescription drugs, and that we were getting ripped off. Yesterday, President Trump met with Congressman Elijah Cummings and me and restated his support to act promptly to address this prescription drug price crisis. This is an opportunity for us to at least begin focusing on health care cost, and prescription drugs is the area where the costs are rising the fastest. Mr. Chairman, I urge this committee to adopt this amendment and begin the process of reining in the out-of-control cost of prescription medication.